Hey guys, it's Nurse Infinity. We're back with another video. In this video, we wanted to talk about pros and cons of Med-Surg, which is a unit that we work. So this is a good video for anyone who's new to nursing or is currently in Med-Surg. We'd love to hear your feedback to see if these are the things that you're experiencing too or what you're looking forward to when you start your nursing career. So if you're interested in what the Med-Surg pros and cons are, keep on watching.
We'll start off with the pros. So, I've been a Med-Surg nurse for about almost 2 years now, and these are my pros and my cons. So, first thing is time management.
Number one.
Numero uno, time management. So with Med-Surg, the patient to nurse ratio is higher than most the other specialties, ICU, ER, whatever the case might be. And our hospital is normally 6 to 1. Sometimes we can, if we're understaffed, the ratios can increase if we're understaffed. So time management is a big thing. I remember when I first started, just thinking, I don't know how I'm going to take care of 6 patients. There's no way. Mm-hmm. There's no way. Like, I'm not going to be able to do it. And just within 2 weeks, you see that it's kind of like, I wouldn't say fight or flight, but you get what I'm trying to say. It's like when you're faced with it's either like
do or die.
It's like do or die. It's like there you go, better. Sink or swim.
You just learn, like, there's a time and a place kind of thing.
Yes, you have the priority.
Yeah, and honestly, like, all of these pros and even the cons all kind of tie into each other.
Yeah.
So, like, with time management, you learn prioritization. So, you all, like she said, you learn what's important, what can wait. Like, you still have to do it, but you learn, can I do this now? Is it something that I need to do now in this moment? Or is it something that I can kind of, at least before my shift ends, I need to get it done?
Like, a patient is in pain, but you have this other person, I asked for water, no one brought me water, and I need water and orange juice or apple juice or something. I mean, this patient...
These are needs.
These are needs this patient has been asking for, and unfortunately no one has brought it. But the person in pain supersedes the person that needs their water and orange juice. Not a great example, but that's just what I'm trying to say. Like, you have if you have 6 patients, you have people, you have 6 patients to be calling all at one time. So you have to learn how to prioritize patient needs, and your time management it will be up there with the best of them. It'll be spot on.
Yeah, I think, like, our time management is great. Like, even we were talking about this earlier, just looking back from when we first started. Like, for me, the first 2 weeks were rough. Like, I was still charting, like, by 10 o'clock, like, still there at 10 o'clock. Yeah, I'm not kidding. Because I was running around like crazy, and then I wouldn't have time to do any of my charting. So I was doing all of my charting at the end of the shift, which sounds crazy. But now it's like, you've been doing it for a while now. You learn every single minute that you have free. You sit and you do what you need to do. And then if someone calls or something else needs to be done, you get up and do it. But like I said, you learn the way of doing things, and within
you get your routine
amount of time, like an appropriate amount of time. Yeah. Instead of being there till 10 p.m. charting like we were, or at least I was in the very beginning. Also, with that, I would say delegation kind of ties into that, because like you said, if someone's calling just for something as simple as water, that's something you can delegate to somebody else. Or
your patients. I think I have a fever. Have the PCT or
take their temp, do their vitals while you're attending to this other patient.
So you learn just to make all those, connect all 3 of those things. Your time management, delegation, and prioritization will be like up there, because it's like your brain will just start the process. Okay, this is what is absolutely necessary for me to do. I can ask my PCT to do this, or no one's available in the moment to do this. Okay, I have to do it, but I'll get to it after I do X, Y, and Z.
Yeah, like your brain is constantly doing that, like the whole shift.
Yeah.
Whole shift. And then with that also organization. Yeah, being organized. Everyone has their own ways of doing things. Like for me, it all starts in the morning. Like when you first show up to work, we show up earlier than our shift.
I show up earlier than her
by like 5 or 10 minutes.
So let that be No.
But we both show up early because we like to look up our patients beforehand, and then we have our own ways of getting ourselves organized. So yes, every day is different, and it's like it's a routine, yes, but it's not like to the T every shift. But at least it helps you prepare, or at least it makes you feel better. To have some kind of control over the shift.
Yeah, I have to somewhat. Everything doesn't have to be super organized in the beginning, but I have to have some type of organization, some type of plan going on.
Mm-hmm.
There's nothing wrong with this, but I know some more experienced nurses or people that I guess don't have as much anxiety as I do. They come in, they don't have to have know everything or have everything organized in order to start their shift and have a successful day. But just personally for me, I have to just kind of for my nerves, for my anxiety, just for my just to make me feel better, I have to have everything a little organized.
Yeah.
So like I said, it doesn't. I'm not OCD. It doesn't have to be
Yeah, and it doesn't it can't be to the extreme where if one thing is out of your routine that you go crazy, because that's nursing.
Nothing's going to go as planned.
No, things happen all the time, but you just have to learn how to adapt, and that's what Med-Surg prepares you for too. You learn how to
adaptation.
There we go, adaptation. To certain situations and patient needs or patient changing condition and things like that.
Yeah. Variety of disease processes. You'll see a lot of different things. You'll have at our floor we get a lot of PACU patients, ranging from bariatric surgery, ortho surgery, GI surgeries, things like that, and all the way from just ER admissions, people that are being admitted just to rule out whatever chest pain, heart attack, GIs.
And all these people, or not all of them, I should say, a lot of them already have history of, so they have other comorbidities or history of certain things. Mm-hmm. So it's you have to include all of that into their care. So, or even if they come with an illness and, they're going to do surgery on somebody, there's certain procedures that I remember hearing about in nursing school, but then it's oh wow, I've never actually seen a patient with that. So it's I kind of Google it real quick and refresh your memory, oh yeah, I remember that, okay. So that's totally fine. You're not gonna know everything about every disease and surgery, but it kind of keeps you active in that way. So you get to see all these different processes and get to learn more about them as well while you're on the floor.
You see a lot of you do a lot of different skills, NG tubes, IVs, Foleys. We have patients that have trachs, peg tubes, wounds.
Wound care.
You do wound care. You have patients with wound vacs.
Yeah.
We don't really do drips, but you have IVs.
Fluids
and stuff, but we're not titrating drips. Not yet.
Not on our floor.
Not yet. We haven't got there yet.
Yeah, but fluids, secondary, piggybacks, all that stuff. You're constantly giving medications. That's a skill too. IM, sub-Q, things like that. So it's another pro that kind of ties into this is just it's a good foundation if you're a new nurse. For me, I kind of wanted this foundation starting in my career just because I didn't feel I was ready to totally 100% dive into a specialty. That was just my own personal decision. But I think it is a good foundation, and then with us we have a 2-year contract, so they also say it takes you a good 2 years for you to even be comfortable doing nursing in any type of skill. So I think the Med-Surg floor is a good start if you're a new nurse or you just don't feel you're like us, or you didn't feel you were comfortable starting in a specialty.
Well, with that being said, I'm just going to add in, start where you want to start. Don't feel I have to do Med-Surg, I have to get my foundation. Apply for that job that you want. Try it, because you'll get training. They're not just going to throw you. Well, I would at least hope that they wouldn't just throw you into your position without training. So if you want to do L&D, do L&D. If you want to do trauma ICU, try trauma ICU. Just personally, for me at the time, this is what it was available for me. At the time, I wanted, I was looking for employment, and
that was opportunity.
It was an opportunity, and then, it was definitely meant to be.
So another pro is that every shift is different. meaning that you're not going to have, we have a general population. So you have all the adults, from 18 to 110. Like, you're going to see patients in all different life stages, and they all come with their own histories, and they're all here for different reasons. So even the night shift, could say, oh, I had no issues, their vital signs are great, they had no pain, and then the second you jump on shift, they're hypertensive, they're in pain, or just all these things can happen just from a shift change, in a matter of hours. So anything can happen. I know Med-Surg, like, the patients are mostly stable and usually are stable, but even then, it's like you have different personalities, like different patients, different kinds of people from different walks of life, cultures, so it's not the same every day.
No, but you're right. It's not the same. Not the same thing every day. No 2 days are going to be the same because it's such a wide variety of the type of patients that you can have. That no, this is never the same because there's so many different reasons why these people are admitted or the reasons why they have surgery. So another pro, I would say, from being a Med-Surg nurse is the reinforcement of your assessment skills. We have 6 patients normally on a normal day, so we have to do a head to toe on 6 patients, and we reassess as needed. We need to do a focus assessment. So your assessment skills really are on point. Like, you know how to do assessment fast, you know what to look for, what to ask, because you do this every day and you're doing it times 6, sometimes more if you need to reassess. So that's something that's that you learn in nursing school. That is it's a big foundation. It's like a foundation.
Yeah, you can't intervene if you
pay
don't
attention
assess.
to that.
Yeah, if you can't intervene if you don't have a proper assessment. So if someone's complaining, well, you don't know what their baseline is if you don't assess them in the morning or whenever. So reinforcing your assessment skills is a big one.
So that was it for our list of pros. Now for cons, first thing I want to talk about, and it's a big topic that people talk about, why a lot of new nurses are discouraged from going into Med-Surg, are patient to nurse ratios and turnovers. Like, the turnover rate is high. That's what I mean by that. So like I said earlier, sometimes depending on the census, you can have more than 6, but generally the ratio on our floor, our unit, is 1 to 6.
Also, varies by state.
By their nurse practice act.
Right.
Yeah.
So in our state, there technically isn't a law or
a cap on how many patients a nurse can have.
Just want to kind of throw that disclaimer out there because I know people that work in Texas, and they have a different, I guess, practice act or different. So their ratios look different than ours on a Med-Surg unit. Obviously, if you're doing a different specialty, that's its own separate thing. But when we're talking about Med-Surg, in our experience and where we work, it's 1 to 6.
So besides the ratio, sometimes that can be higher than expected due to the census that we talked about. Turnover rates can be high because we get a lot of admissions and a lot of discharges. So with the surgical patients, they come to your floor. So depending on how many cases they have that day, you'll admit a lot of patients, and in the same process, you have discharges too. So sometimes it can get a little hectic, because you'll be discharging a patient and getting a new admission from either the ER or PACU.
And it's at the same time.
It can be at the same time. And then sometimes you might come into work and all 6 of your patients are discharged. Yeah. And then you're getting patients throughout the day. So that can be a lot to handle, but just with practice, you'll get your routine down, and just
that time management.
Yeah. Just don't stress out.
Yeah, and don't let patients. I know a lot of patients, they just want to go home, which is totally understandable. But just use your communication skills, and say, it's kind of a process. I'm working on it, and we'll get you out of here as soon as possible, and move on to the next pressing issue. So another con that we experience working on the Med-Surg floor is that it's very physical. I think it's kind of nursing in general. But with the ratios that can be high and the type of patients you can have, sometimes you find yourself doing these things alone. And when I say things, I mean just basic incontinence care or changing patients, bathing patients, things like that. That's things that need to be done. You can't have patients going days and days without hygiene care. So if you're doing that for all of your patients, and sometimes you're doing it multiple times a day, it's very physical, and that's adds kind of more to the stress because you're also dealing with a million other things that are going on the floor.
You're constantly going. You don't have time to sit down.
Just remember that it's physical, and just be safe.
Get some good shoes.
Yeah, get some good shoes. And a lot of us wear smartwatches, and we're always looking at our steps and be like, wow, today was a good day or a bad day because look how many steps I did today, because you're running around the whole unit. So that to us it is a con, because it also puts like our health and like our back health and things like that at risk. So just be safe and just be mindful of your body mechanics and the things that you're doing. Make sure you're doing things safe. If you can't lift a patient, don't lift them. Get someone else to help, and you guys do it together, because you want to be able to work. You know what I mean? If you're new, you have your whole career, and you need to save that back always.
So another thing on my cons list is, I noticed that sometimes, even with myself and other people complain of it too. Well, then I wouldn't say complain, but they have noticed that you become task oriented, because sometimes you'll have so much to do. Like, this person's going to surgery, I have to give them another IV, they need to sign their consent. This person needs an NG tube. I'm admitting this new person. I'm doing, you know what I mean? Like, there can be a lot. So
I think you kind of sometimes get lost in your checklist,
and you're
like being just tasked, like just checking things off the list. That sometimes, which leads into another con of ours, is you lose that patient care and that patient connection. Not to say we don't do it at all. I'm just saying, like, sometimes to be honest, you just don't have the time to sit there and even just have a conversation for 15 minutes. You know what I mean?
You stay as long as you can. You talk to the patient and address their needs and concerns. But I mean, even 15 minutes might be enough for the patient. But like, what if you want, talk for another 15 minutes? You don't have the time.
Yeah.
Just to reinforce that relationship and gain their trust. But then you have days where it's a little slower, and you actually have the time to really like build relationships and get to know your patients. So
yeah, and you see the difference. You know the difference between when you have the time and when you don't have the time. And like I said, all of these things tie in together, because this all goes back to the ratios. It depends on how many patients you have for that day. It depends on what's going on in that shift, or what are you prioritizing at that time. If this patient's blood pressure is tanking or it's through the roof, like,
you're not going to be sitting having a conversation.
Yeah, like to talk, to learn more about this patient, which is sad. Like, it's kind of crappy to say, but it's kind of the reality of what we find in our shifts sometimes, being on the floor, which for us, nursing, being the personal connection is a big part of why we chose to do nursing in the first place.
Like I was saying, I read an article that was talking about how Med-Surg is now being looked as a specialty. In the past, it really wasn't, but now that people are considering it a specialty because just of the wide variety of medical conditions that nurses see, and Med-Surg nurses now make up more than a majority of bedside nurses. So, with that being said, just a little fun fact.
Yeah, just don't shy away at the opportunity, because like I said, with every specialty or every career path in nursing, there's always pros and cons, and this is kind of the list that we came up with from our experience. So hopefully it helps some of you guys make a decision, or even just get an insight of what a Med-Surg nurse does. So hopefully you found this video informative and helpful.
Like, comment, subscribe. Please let us know. Leave us some feedback.
Share with your friends.
Share, and just everyone stay safe, and thank you for tuning in.